it depends on your insurance plan, and I think there are a lot of roadblocks that can come up, and there are extremely long wait lists, as you mentioned. And so that's true of, there's a shortage of child and adolescent psychologists, there's a shortage of developmental behavioral pediatricians, there's a shortage of child and adolescent psychiatrists. That being said, oftentimes the data that will be gathered by any one of those professionals, and I'll just speak as a psychologist, often some of the data that I would gather for a comprehensive assessment is often the same data that is gathered through a special education initial evaluation. And if a child is having, any challenges in school related to attentional concerns, parents have the right to request an evaluation in order to really clarify if the challenges that the children are presenting with are impacting their education. And so one thing I would encourage families, just like an evaluation in a healthcare setting for a behavioral health condition, similarly in schools, if an evaluation is conducted, it doesn't mean that parents will have to consent to a specific service. And so I often recommend that requesting a special education evaluation, which should include evaluating behavior in the classroom, getting some behavior rating scales from parents, will often look at learning and may look at kind of learning capacity or cognitive functioning or brain functioning in a way. And so that data can be really helpful in a clinical setting as well. And so that's one option. However, a school won't and isn't able to diagnose ADHD just because of the way the system is set up, and their focus is more on educational conditions. Sometimes there are training, like psychology training programs that might have a wait list that offers free or reduced cost or sliding scale evaluations. That's one creative option. Other creative options could include, I would always recommend that families also call their insurance and ask what the options are for psychological assessment through their insurance. But really, to make a good quality diagnosis of ADHD, there are not a lot of formal assessment tools that need to be used. Those tools can be really useful for identifying strengths and weaknesses and for ruling out any other coexisting conditions. But if you're really just trying to make a diagnosis of ADHD, behavior rating scales completed by parents and teachers and a really comprehensive interview with parents about a child's history and the symptoms can be sufficient for making a diagnosis. But we also, to really make sure that we are ruling out any other conditions that could present like ADHD, that's where the utility of a comprehensive assessment comes in. And unfortunately, it's really tough because there's not a lot of good options